areas of the body.
Right.
So, and again, you don't have to, you can, if you want to, be like this. You can be in some other land and some other place if you want to. But you can also be completely anaesthetised selectively in areas of the body and walk and talk. It's a learned skill, and we show people how to do it.
Right, exactly. And then, that's the waxing area. Then, we'll talk about one, we actually have a program for this. This is a little more extensive, pain-free childbirth.
Yes.
And where we teach women to and it's not numb that area, it's take away pain in that area, right, from here to lower. And the whole point of that one too is that is not numbing, because you want her to be able to feel the sensations.
Well, again, this is something that's changed a little bit historically, and I suppose the trends and fashions of society change. If any of you look at the work of Angel Escudero in Spain, who's a surgeon, you will see him, and Esdale talks about, not Esdale, Ellman talks about, and others, as a famous doctor, Kroger, who did a lot of work on hypnosis, wrote an excellent book on obstetrics and gynecology and childbirth using hypnosis, marvellous book. But their idea was, at the time, was that they wanted women to be almost in a state
right,
of general anesthesia, like give birth like this,
right,
like this, with a smile on their face.
They were basically at the Esdale or coma state.
Yes.
Some of them, right?
Right.
So that you're
out.
You're out.
Right.
And they can give birth in that.
And they can give birth in that state
if you want.
And their great claim was that they could perform an episiotomy. And again, if you don't know what that is, check it out. But it's basically an incision. And the woman kept a smile on her face. Nothing disturbed her. This was like a badge of that was great. Again, these days, most women have a different concept of what they want from childbirth.
Right.
They want to be present. They want to participate in
right,
the birth of their child.
Right.
But they want to do it in comfort, free of pain.
Right.
And so the sort of hypnotic aims are different. So in the process that we teach, you experience sensation. You experience the birth. You are very much there, but you do not experience discomfort. You do not experience pain. Even the contractions are experienced as, so women tell me, as waves of pressure
right,
and pleasure, surprisingly. Right. All this can be done hypnotically with training and with practice.
Right.
Yourselves.
Right. And that's the whole thing. That's really important with that one, because with other things, dental, you might want to numb the whole area. But with something like that, they don't want it. Like you say, they want to be present. Right. And so you'll experience all the contractions. You'll feel them as pressure and this and that. They just won't feel painful. And when I did my dental anesthesia, I could feel sensation.
Right.
Similar thing, but I didn't feel pain.
Right.
And that's huge. And that's that was, if you couldn't do that, a lot of women would be put off by it, because they want, like you say, they want to be there.
And again, just to clarify this of what we teach, this is a very good, excuse me, a very good point. Some people think that what we're teaching is a combination of mind over matter. In other words, or that we're teaching people to bear pain. We are not. We are not teaching you how to grit your teeth and suffer through it, even be. And how do we know this? Because when these surgeries are performed, and you'll see if you watch those tapes of the BBC, they're taking measures. They're taking measures of people's heart rate. They're taking measures of other things, skin resistance. They're seeing, are these people in a physiological sense exhibiting symptoms of stress? Because if they were, because the anesthesiologists are right there, they're going to come in and use chemical anesthesia.
Right.
Or they're not.
Right.
So these is just not thinking yourself into a different place.
Right. And the other thing about, like that one in particular, pain-free childbirth, even if you say, well, I can tough it out and all that myself, the births go faster.
Yes.
And so it's less stress on the baby and
yes,
so forth. So even if you didn't want to do it for yourself, it's great for your baby. And that's because if you think about it, if you're having the contractions trying to force the baby out, if you perceive it as pain, you can clench down, right, and your muscles clench, and
right,
it doesn't allow it to open as easily and let the baby out.
Right.
And so by not feeling that, it makes the contractions more effective.
Yeah, well, quite simply, to put it around, active labour is just much shorter. using
Right.
these processes. And again, this is an example. I want to emphasize this is something that anybody can learn. You do have to learn it. Now, here we want to distinguish something that's very, very important. It comes back to this idea that, well, if I just relax enough, and if I just think myself into a different place of teddy bears and swings and forests and beaches, everything will be fine. Well, I've got bad news for you. That doesn't work.
Right.
Or it only works very, very rarely and selectively with people. We call this forms of creative visualization, and there has been a movement around for some years that has tried to convince people, the general public, you folks out there, that this is exactly the same as what we're talking about hypnotically. This is not the same thing. Even if it's described as the same, there is a famous program out there called hypnobirthing, and I'm going to say it on the air. It is not hypnosis in the sense that I mean it. It is creative visualization. It has its place, it has its use, but it is not the same thing that we are talking about here. So it's very, very important to distinguish between true hypnosis under the definitions that we mean, the bypass of the critical faculty and the admission of selective thinking, and these what I call creative mental processes, which I'm not saying they have no place, I'm just saying that it's not the same thing. And it won't produce the same effect.
Mm-hmm. Do they do any form of even light hypnosis in that, do you know?
Kind of. But again, there's no testing of the bypass of the critical faculty, and there's no, frankly, true understanding, in my opinion, as to what hypnosis really is. We are very, very, very clear about what we do. What we do when we're working with people is to bring people into a state of somnambulism. And we distinguish this from a state of what's called false somnambulism, sometimes described as aphasia, where people appear to be very, very relaxed and unwilling to talk. And this is not the same as true somnambulism. Famously, Ellman describes the difference, Dave Ellman, who we talk about a lot, and said, I would never want to have a procedure under full somnambulism because, as he puts it, it would hurt like the very devil.
Right.
I love that phrase.
Right, exactly.
Hurt like the very devil.
Right.
And it's very true. So we have a way of distinguishing between one condition and another. And here's the important thing. If you are going to learn these procedures for yourself, if you are going to learn how to do this, you want to have somebody who can show you what the difference is between one thing and another, so that you know that you are bringing yourself into a state where you can create true anesthesia to the level of your skill and the degree to which you're willing to practice doing this.
Right. I mean, and I actually had a client recently ask me, he says, oh, I've seen these hypnotic relaxation tapes. Are they any good? And what I told him is, yeah, to get you into a light hypnotic state, maybe, light state of relaxation and things like that. But to do something like anesthesia or something like that, no. You have to be in a deep state of hypnosis that's termed somnambulism.
Right.
There's lots of different levels of hypnosis. We go in and out of hypnosis every day.
Right.
Light states a lot of times, but we make sure we bring them deep, and that's where we work.
Right. And so, when we're working with a client, when Bill and I are working with clients, we bring our clients routinely to states of somnambulism. And again, even that term, somnambulism, from the hypnotic tradition that we come from, we mean it in very specific ways. The threshold of somnambulism is amnesia by suggestion. There are tests for somnambulism. In some hypnotic traditions, that's a description that they use for what they classify as deeper states. But we mean, in reference to this, and as far as self-anesthesia is concerned, we're talking about a state which is necessary, a precursor for the ability to create anesthesia selectively, specifically in parts of the body. And if one's going to go further and produce what's sometimes called the Esdale state, or sometimes called hypnotic coma, although it's not a coma, but this deep, deep state where spontaneous general anesthesia arises, then a precursor to that is somnambulism. You need somnambulism or to move through it to get to that state.
So one of the things about it is, to be clear, is that if we're teaching someone how to do dental anesthesia, right, is we're going to make sure that we bring them into this deep state of somnambulism, and we're going to test, because that's the only way you know if
Absolutely.
They're in that state.
Absolutely.
Okay, like you say,
100%.
that you can get numbness of a part of the body, that you can make numbers disappear, and things like this. And so we make sure they're there, because then that's where we implant the suggestions that they're going to use in a waking state to bring on the numbness.
Right, and so what we do is we teach this procedure. We have a step-by-step process. Initially, we bring people into the hypnotic state. We show them how to bring themselves into the hypnotic state. We show them how to selectively anesthetize. We then show them how to selectively anesthetize in a waking state. So it's a series of procedures, and these procedures that we teach, these processes, they do require some practice, but they don't require hours and hours and hours of practice. So when we're teaching, for example, the types of anesthesia that we use for pain-free childbirth,
Right.
we are asking women to practice 10 minutes a day, if preferably 20 minutes a day. And if they do that for a period of 2 to 3 weeks, then they are going to experience pain-free childbirth if they follow what we're asking them to do, and if they come back to us and we can monitor and check to ensure that what we're asking them to do, they're actually doing, and in other words, they're following the correct procedure.
Right.
And so the value of having people who are trained hypnosis practitioners doing this with you is that we will be able to know and confirm that you are following correct procedures to bring yourself into these states. You won't have to guess at it. You won't have to listen to a tape and think, is this happening for me? Is this not happening? And when are you going to find out? On the big day when it all occurs. You'll know.
Right, right.
And how will you know? Because we know. And how do we know? Because we've got means of testing.
Right,
We've got
we test
procedures,
for it.
right? So you're not in any doubt. That's the value of working with us.
Because on your own, you know, if you're not trained, you can't tell what state of hypnosis you're in. I had a client recently that said, I wish this was more powerful because of X, Y, Z.
Right.
And what he thought that was an indication of not being in a deep state wasn't true at all.
Right.
You know, because he doesn't know how to test it,
Right.
and all that. And so it's really important to be trained by a professional. The other thing about a painless childbirth, and this goes to a bunch of different things too, is that we if you go through our program, we teach them how to take away pain in that area of their body, but we also do work after that helps with milk production and things like this. Suggestions.
Sure.
Makes everything easier afterwards.
Everything easier. But let's talk about also some of the other things, Bill, because we talked about dental work, we talked about cosmetic procedures. Let's talk about some of the other things too that you can use self-hypnosis or self-anesthesia through hypnosis for.
So one of the things that was used, and I think Dave Ellman used this, was they called it the magic spot, I think.
Oh, it's marvelous.
It's and basically what it is you give somebody, bring them into deep somnambulism, and you give them a suggestion that there's a spot that they won't feel sensation when they get an injection.
Right.
And so you can give that to a child, and so they won't have to be afraid of the needle stick anymore.
Yes, and pediatricians and doctors love this. I mean, it's a fact of modern life and modern pediatric practice that there's a lot of time spent giving kids jabs, inoculations, and understandably most children don't react well to that. It can be a real problem. Some of them, they experience pain, some of them great panic, and it's a great problem. Well, Dave Ellman taught this marvellous technique called the magic spot, where you create a spot somewhere, and that becomes the place from that point where you can be anesthetized and you feel, not anesthetized, but given a shot, a jab, and you feel no pain or discomfort. The funny thing he said is that after he did it with the children, the adults came and said, I want a magic spot.
Right.
Right, and again, this is a simple procedure. Doctors could learn it, nurses can learn it, paramedics can learn it, and it can help. So simple to do.
Well, and if you think about it, I mean, there are people that are absolutely terrified of a shot.
Yeah.
And if you give them this ability, and I'd also give them suggestions about, relaxation and things like that, then all that stress, because they're stressing out beforehand, maybe even a day beforehand, thinking about, okay, I'm going to get a shot. You have blood draws. We all have to be subject to blood draws. Yes,
another area where if either you're donating blood or you have to have a blood draw for an impending procedure or just as part of a routine exam, why suffer discomfort?
Right, exactly.
No need. So that you can use this technique. I've got a funny one that I want to tell you.
Go ahead.
Now, this is something that I don't have, and I have no personal experience of, but some of you out there might like tattoos. Some of you might have tattoos. And tattoos is a funny thing because in the sense that some people seem to want to experience a certain discomfort, almost like a badge of honour. I don't know. But I had one client that I worked with on an entirely different matter, nothing related to pain reduction or anything like that. And she told me that her and her sisters, just before she was going to get married, had decided that they were all going to have a tattoo fairly low down on their abdomen.
Oh boy.
Oh yeah.
Sensitive area.
A pretty sensitive area,
Yeah.
right? And the first time she went, they all went, and she was just touched with the tattooing tool, and she couldn't stand it. And she said, I don't think I can do it, but they still wanted to have it. So I said, well, why don't you use hypnosis?
Right.
And I said, you already know how to do that? And she said, I do. And I said, yeah, I demonstrated it with you, do you remember? So we reinforced it and we showed her. So she went back. She had her sisters didn't believe any of this, of course, and they'd had the tattoo, but apparently in some significant pain with a lot of screaming and discomfort, and she, no problem at all. But here's the funny thing. She didn't even believe that it was really true, even though it was happening to her.
Right.
So she said, so I tested it out, and I said, what does that mean? And she said, well, I decided to take away the suggestion, see what happened. And I said, and what happened?
Yeah.
She said, I couldn't stand it, I just came to stop.
Right.
And then she put the suggestion back in, and no problem at all.
Yeah.
So even though it was happening to her, even though she was experiencing it, she didn't believe it.
Well, that and it's really funny because even as hypnosis practitioners, you still have that belief. Like, how could that really happen? I mean, I had one where I had a wart frozen off, and I had said to the person, "Was that supposed to hurt? I mean, does that generally hurt?" And she said, "Oh yeah, some people are in tears."
Right.
And she said, and especially children, but even adults. And I said, I didn't feel anything.
Well, again, let's take wart removal. Now, again, fortunately, a lot of us don't have those, but some of us do. And if you have warts on your fingers or maybe a wart on your arm or something in your hand, well, the processes of removing them through salicylics or freezing, that's not so bad, right? I mean, it's tolerable. But genital warts might be a different thing, right? Freezing in that area and salicylics, not pleasant. So the capacity to remove, to use that anesthesia if you're going to have a procedure in those areas is very useful. Actually, we did something recently on warts. One of the most amazing things is that wart removal can be removed. Warts can be healed entirely by long demonstration through hypnosis. And the rate of return is almost zero, whereas if you use salicylics or freezing, the rate of return is about 30%.
Right.
So, remarkably.
Right.
But if you need to anesthetize a sensitive area, our hero Dave Ellman talks about proctological procedures that he needed to have.
Right. Another sensitive area, very hard to anesthetize.
An anesthesiologist. Check it, folks, with your local anesthesiologist. Very, very hard area to get consistent and ongoing anesthetic to. Not easy. Demands a lot of skill. And Dave Ellman in his tapes and by record describes how he had proctological procedures using only self-anesthesia. There was nobody there to do the anesthesia for him.
Right.
So again, we're not suggesting that you have to do that. We're only showing you where it can go and how you can use it for some things. What are some of the other things?
One is burns. If you burn yourself, and relieving the pain from that. I believe you actually did that.
I've done it a lot.
Once.
I like to cook.
Right.
Every so often I do something really stupid, like touching a hot pan, or maybe I should hypnotise myself not to do that, or something spills on you or splashes on you. And there's a great deal you can do, not just to alleviate the discomfort of that initial burn, but to ensure that it doesn't move on to second and third degree burns, something that we've described on the show before.
Right, because we described it with Dabney Yu, and an MD who wrote about this. And he was
extensively,
I think, head in a burn unit.
Yep.
And what he found was that by giving suggestions to these people, I mean, they got all the normal standard treatment.
Yeah, they do.
So we're not suggesting anybody just use this itself. They got the normal treatment, but when he gave them suggestions for coolness and comfort and so forth, the body didn't send in its normal inflammatory substances, which actually creates he says, a secondary burn.
Right.
You get the tissue damage from the initial, but then your body sends in these agents to try to help.
And you get the inflammatory response.
Right, and it makes it worse, a secondary burn.
Right.
So when you gave those suggestions then you wouldn't get that.
Right.
So you'll definitely want to do the standard things to take care of a
Yeah.
burn, but you can actually even make them lighter by using this. And
Yes,
it's very quick and easy.
Yep.
You know, the other one we can talk about is sports injury.
Oh, yes.
Well, this is one I saw some pictures on, which was the resetting dislocated shoulders,
Yes.
and so forth. And you know, because basically, if you pop your shoulder out of joint, the picture I saw of it is they can put like their foot in here
Right.
and pull on your arm.
Or
And
whatever. They call
Oh.
it, medically, they have a nice term for it, reducing
reducing
dislocation or reducing a fracture, which basically means resetting it.
Right.
And these are very often either through bone fractures or dislocations, very, very painful procedures.
Right.
Yet, using hypnosis, and particularly, and again, Dave Ellman was teaching doctors how to do this. Because of the general state of hypnosis these days, we're not expecting that if you unfortunately have to see your orthopedist or internist or so, that they're going to know how to do this. So you have to learn how to do it. If you want to take advantage of these processes, you have to learn. And if you're an active sports person, and particularly if you're involved in contact sports or any sport where it's possible you can be injured, the capacity to anesthetize yourself selectively can be very useful, not to mask.
That's one thing I was going to say.
Not to mask.
We've got to be very careful. If someone comes to us with pain, okay, say chronic pain or whatever,
Say migraines or headaches.
anything, we first ask them, have you seen a doctor for
Right.
it? Have you had tests for it?
Right.
And so forth, because we don't want to mask. What if you had a tumor and we mask the pain, then you don't get the treatment.
So I remember
Very careful.
A few years ago, I was with my now ex-wife at a salon, and she was having her hair done or something, and I was just there, and I noticed that one of the other stylists was limping around, and she had her foot bandaged up, and I asked her what had happened, and she said, well, she'd fallen and she'd sprained it, but she hadn't got time to go and see a doctor fully. It was just bandaged up, and since she was on her feet all the time, I asked her how she was coping with that, and she said it was extremely painful. She was in a great deal of pain, and I said, would you like to alleviate that? At least she said, well, how? She had a 10-minute break. I took her in the back. We did some quick hypnosis, and I gave suggestions for the alleviation of that, and she was able to continue with her workday without any discomfort whatsoever. But I also gave a suggestion at the same time, telling her that she would ensure that at the end of her shift or when time allowed, she would go and see a doctor. She would see somebody to ensure that was properly treated. So I didn't want it was temporary.
And the other thing you can do is you can give the suggestion that until the end of the shift, that you won't feel the pain. After that, it comes back. Did you do anything like that to take away the numbness so that it wouldn't keep being masked?
I did.
Yeah, good.
Right, that's generally a precaution that we use.
Right.
And so generally anaesthesia will last as long as it's determined to be useful.
Right.
That's why after you have a dental procedure, for example, the anaesthesia can last beyond that because it still has use as the
Right.
healing continues.
Right.
But it won't continue forever.
Right. And the other thing about some of these is, you say, can you mask anything? Well, there are going to be certain things that the pain is there from the subconscious as a signal to say there's something wrong here.
Correct.
And in those cases, you may not be able to mask it at all because
We never mask it. We
no,
may not
but
be
I
able
mean,
to
alleviate it is what
Right.
I mean. Because the subconscious is going to say no.
Right.
The person needs this signal.
There's something happening here.
Right. There's
Yeah.
something there. So so you've got that
Yes,
kind of
because-
safety mechanism. there.
Absolutely, and because also acute pain following a traumatic injury is a safety mechanism. It stops you injuring yourself further. It stops something happening.
Right.
So, how'd you learn this, folks?
Right. Go for it. Yeah.
So the fact of the matter is that you need to see a trained hypnosis practitioner that understands how to produce these effects in people and how to teach you how to produce them in yourselves. And one of the things that I would ask if I was approaching a hypnosis practitioner is, do you do this for yourself? Can you do it for yourself? Find out. Because some hypnosis practitioners, I'm sorry to say, are petrified of doing these things. They won't do it. They'll talk about it and they'll lecture about it, but when you ask them if they're willing to actually do it themselves, they won't. That's one of the things I really admire about Dr. John Butler in those tapes. He's on TV.
With the BBC
He's
special.
right there.
Yep.
He's got, hey, have you got any doubt? He says, I'm right there. I remember he does this, if you look at it, there's a little talk he does online, and he puts an Alice clip, which is the clip that's used to hold skin open and things in surgery. He puts it right on his hand, puts it down to 3 notches, and then just very calmly continues to give his talk. Marvellous man. I admire that.
Yeah, because that would normally be very painful.
And so someone like Butler, people like ourselves and others trained in this way, can not only produce those effects in people by stimulating your subconscious mind, but can show you how to do them.
Right.
Now we have a series of procedures. We show you. We have a program as to how to do that. So you can learn it from us. And it's a life skill. It's something that you can learn and have forever. Nobody can ever take it away from you. Whatever circumstances you find yourself, whether you're young or old, male or female,
Right.
In this country or another country, you will learn a skill which you keep with you for the rest of your days, as long as, like any other skill, you maintain a certain degree of practice.
Right, you just practice it. And we teach you how to do it and how to test that you've truly got there, which a lot of times can involve a pinch or things like that. But you will be able to prove that you definitely have the anesthesia.
Right.
Yeah. Yeah, so how many sessions does it take generally?
Normally, it's something that we do I do it over 3 sessions.
Right.
Sometimes you can do it more quickly. Some people it takes a little longer, but usually 3 sessions, at least in our program. And those sessions are not one after another. We give people a period of time to practice certain things between.
Right.
So normally, the acquisition of the skill, depending upon yourself and how you do it, anywhere from, at the outside about 3 weeks. It doesn't mean that it takes 3 weeks. You can literally learn the skill in a few days, but if you give yourself time to practice.
Right.
Even Dave Ellman says that when he first learned to do some of these things, he wasn't very good at it.
Right.
He practiced until it became, as he termed it, reflexive.
Because it strengthens it. Our term is compounds it.
It compounds
it. So it gets stronger and stronger as you
time.
practice.
Exactly.
Yeah, exactly. So I think we're like right near the end here.
We're right near the end. So folks, hypnosis for self-anesthesia. Find somebody that can teach it to you, learn it, practice it. It's a life skill. It's a wonderful skill. It'll open up a whole new world, and it'll also form the basis and the foundation for other hypnotic skills as well.
Right.
So thank you very much for watching this edition of Hypnosis Helps from me, Neil Myers, hypnosis practitioner, from my colleague Bill Miller, fellow hypnosis practitioner. We hope hypnosis helps you.